Hello friends. Today we're going to discuss about treatment gap in psychiatry. I am Dr. Suresh Bada, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about treatment gap in psychiatry. Why is it important? What is the prevalence? What are the factors contributing? And what should we do to reduce this treatment gap? Let's understand about the epidemiology of psychiatric disorders. In any given community, 10% of the population do suffer from psychiatric disorder. That means if you randomly survey 100 people and look for mental illness, 10% of them do have diagnosable mental disorder who require professional help. These mental disorders are known for their stigma, discrimination, unemployment, considerable suffering, disease burden, and poor quality of life. They not only suffer by themselves, but also the whole family and the community do suffer. To compound this, there is a public health problem also. Many of these patients in the community do not receive treatment for at least 1 to 2 decades. So that is called as treatment gap. Let's define what is treatment gap. Treatment gap in mental illness refers to the disparity between the number of individuals who require mental health treatment and the number of people who actually receives evidence-based treatment. Let's understand by a simple diagram. Please take any given community, maybe a district. In that district, there are 100 persons with schizophrenia. And in that, only 20 people are receiving evidence-based treatment. Here, the remaining 80% will be considered as treatment gap. That is, the number of people who are diagnosed mental disorder not on treatment. That is as simple way of putting the definition of treatment gap. The treatment gap represents the absolute difference between the true prevalence of disorder and the treated proportion of individuals affected by the disorder. It also can be defined as the treatment gap may be expressed as the percentage of individuals who require care but do not receive treatment. In simple language, it can be defined as treatment gap is the number of people with mental illness who need treatment but who do not get it. It is also called as untreated rate also. The treatment gap highlights the widespread unmet need of mental health services and the challenges in providing services, access to the treatment, and also the evidence-based treatment who require treatment in the community. But please understand, treatment of a psychiatric disorder is not so easy. To understand the treatment of psychiatric disorders in a community, you need to understand the pathways to care. As per the World Health Organization, if you look at the idealistic way of the treatment which should occur in a community, as per this pyramid, at the base of the pyramid, you can see the quantity of the services required. Of course, at the base, it's huge. On the right hand side, you can see the frequency of the need. That means how much frequently the services has to be given. At the base of the pyramid is very low. At the apex of the pyramid, it's very high. If you look at the left side, you can see the cost. At the base of the pyramid, the cost is very low. At the tip, it's very high. If you look at the base of the pyramid, the self-care, meditation, mental health hygiene, how to take care of emotionally, staying away from substance use, drug abuse, is the need of the hour for the general population. That is prevention and promotion of health. That is the base of the pyramid, and it is required for the entire population. The next step is the providing care at the primary care level. Here, one need to provide first line of treatment, that is screening, diagnosing, and starting first line of treatment. Above this is the community health level and psychiatric services in the general hospital, that is in the district hospital, and finally mental hospital institutions. This is how the WHO visions regarding the psychiatric care. But however, the top of the pyramid is the specialist care, which is very rarely available in a developing countries and also in many developed countries. There are various reasons for that. Let's look into that. In reality, the pathway to care for psychiatric disorder does not go in a straight line. Suppose a family member develops a mental illness. Invariably, they approach the family friends, peers, and invariably they are taken to faith healers. If there is no improvement, they go to religious leaders, temple, church, dargah. They will do various religious rituals. They may even sought help from numerology, astrology, and if this does not work, they consider going to complementary alternative medicine, maybe Ayush, and various other help-seeking behavior will be seen. Once the illness becomes very severe, then only they approach allopathic doctor, that may be MBBS doctor in primary care or maybe in the district hospital. And by the time they reach the psychiatrist, invariably many important years would have been lost. And this becomes a duration of untreated psychosis. That means more the duration of untreated psychosis, there is a high possibility he may not respond to the treatment at all. This is the simple way the diagram can be seen. The first, the person experiences psychiatric symptoms, and it may be subsyndromal, and many a time he may not know that he is suffering from mental illness. And family members may think there is something wrong with him, and they will take him to various faith healers, religious leaders, church, temple, dargah. And very important time is lost here. And many a time they may consider going to various primary care doctors. Invariably, across the country, the primary care doctors are not adequately trained in psychiatric disorders. Hence, they may not get the evidence-based treatment. Even if they have to travel to the primary care or maybe to the district hospital, the long distance, need for a human being to be with the person, that is a family member, loss of wages of the two people, travel cost, doctor's fees, treatment cost, all this will add to the burden. And many a time, they do not get adequate counseling, education regarding the psychiatric disorder, need for treatment, need for to continue the treatment for prophylaxis purpose will not be explained. And this leads to frequent relapses, and the whole family becomes isolated, or else the person with mental illness is isolated and he never recovers, and the rehabilitation becomes a distant dream. This is how a person with mental illness in a community becomes isolated. Let's understand various concepts. If you take a person with mental illness in a community, either it will be detected or undetected. The reason for being undetected is there is no access for treatment, or else the family members are worried about stigma and discrimination by the community. Hence, they do not seek treatment. And those undetected cases are also called as detection gap. The people who are detected with mental illness by a healthcare professional may offer treatment, Many of them may consider treatment, and few of them may refuse to take treatment, telling that they are not mentally ill. Those people who are not treated will be considered as a treatment gap. That means the people who are diagnosed to have psychiatric illness and not on treatment is considered as a treatment gap. The people who are treated may be with medication or therapy alone or a combination of both. So, you need to understand these two important concepts. One is detection gap or diagnosis gap, and the another one is treatment gap. What are the benefits of reducing this treatment gap? Why is it so important? If a person with mental illness, if it is not treated, his quality of life will be very bad. It is not only the person is suffering, the whole family will be suffering, and they become so socially isolated. They're worried about the stigma, discrimination, what will be the relatives will be telling regarding the future marriage alliance, job, the future vision, dream of the family will be shattered. That is a very important reason to reduce the treatment gap so that the treatment is available for everyone. If the person is not treated, the time spent in disability and illness will be very huge. Nowadays, the various studies published in Lancet and various international journals clearly says the person with mental illness have high morbidity and also high mortality. That means invariably person with mental illness spends 10 to 15 years in mental illness and they die early at least 10 to 15 years than the general population. That means mortality and morbidity is very high. Not only that, since they are mentally ill, they are unable to work, they are unable to contribute, and they are burdened onto the family and to the community. This causes an economic burden on the society and the community. Not only that, their human rights violations are well known. Hence, in a social welfare society, we need to reduce the treatment gap and make sure they receive treatment in time and they improve and contribute to the society. But however, defining this treatment gap comes up with various challenges. Let's discuss this. The challenges with regard to treatment gap. Various people have criticized the treatment gap definition given by WHO. They say it's a narrow way of defining treatment gap. Why it should be only medication? Why it should be only allopathic treatment? Why can't we include complementary alternative medicine? Or else if the patient has approached Ayush doctors. As you know, many of the patients in the rural area, they approach Ayush doctors. Approaching to the Ayush doctor is not considered as a treatment unless they meet a MBBS doctor. This narrow definition has entered into criticism by various people. Even if they reach the allopathic doctor, he needs to start medicine. If you don't give medicine, still it will be considered as a treatment gap. That means it is a capitalistic, medication based definition. Hence, many people have criticized that. Why not consider starting a psychosocial treatment? If the patient receives AAA, that is Alcohol Anonymous group, where he goes for treatment or else for a spiritual healing, why cannot be considered as a treatment gap? Why we need to medicalize certain simple social problems? A woman who is going through a domestic problem at home or a domestic violence, she may be depressed. Why should we medicalize this and call there is a treatment gap? Whether inadequately treated with the dose or duration, should we consider as a treatment gap? If the patient refuses to take medication, that is poor compliance to medication, in spite of advice given by the doctor, what should be done? Why not enable locally available, culturally acceptable treatment methods? Many patients with common mental disorders, minor anxiety disorders, go to temple, church, or dargah, and their symptoms do reduce. There are various literature available. Why need to give medication? Further, religious and spiritual help have been found to be helpful in mild to moderate common mental disorders. Why we should say only allopathic treatment is required, and if they don't come for allopathy, why we should call it as treatment gap? This is the biggest challenge which looms around for the definition. Now let's understand the international studies. What do they say about treatment gap? There was an important landmark study done by Robert and his colleagues in 2004. The title of the study was Treatment Gap in Mental Health Care. This was published in Bulletin of World Health Organization 2004. In this study, they looked into the extent of treatment gap in psychiatric disorder. They reviewed all the available studies, especially which are done in the community. 37 community based psychiatric epidemiological studies were selected, and they looked into these epidemiological studies, the service utilization pattern, and how many people are on treatment. And Robert and his colleagues came up with this results. If you look at the WHO American countries, the treatment gap for schizophrenia, major depression, dysthymia goes from 80% to 40%. That's the huge number. Whereas in Southeast Asia, we had only for schizophrenia 28%, and we did not had any data for other illnesses. This was in 2004. That clearly indicates even in developed countries, the treatment gap is huge. What about India? There was a national mental health survey done in 2014 and 2016 by Ministry of Health and Family Welfare, and the study was executed by National Institute of Mental Health and Neurosciences. And in this study, they did the examination of 39,532 individuals across 720 clusters, 80 taluks, 43 districts in 12 selected states. The psychiatric morbidity lifetime prevalence was 13.7%, and cross-sectional prevalence was 10%, and severe mental disorder was 0.8%. So, if you look at the prevalence, mental health morbidity at the point prevalence is 10%, common mental disorder is 10%, and severe mental disorder is 0.8%. However, if it translates to whole of India, we have 140 crore population, 10% have psychiatric illness, that is 14 crore, and 0.8% have severe mental disorder, that is 1 crore. That is the number we need to treat. Unfortunately, the people who are on treatment are very, very less. The same study clearly indicated the treatment gap was 70 to 86% in different disorders. With regard to bipolar affective disorder, 70% of them were not on treatment. Psychosis, 75% were not on treatment. Alcohol use disorders, 86% were not on treatment. This is a huge gap between the number of people who are suffering and number of people who are on treatment. Now let's understand the treatment gap using alcohol use disorder. Then only you'll be able to appreciate what is the concept, how this has evolved. There was an important publication published by Abhijit Nadkarni and his colleagues in Cambridge PISM Global Mental Health in 2023. And the title of the study was Closing the Treatment Gap of Alcohol Use Disorder in Low and Middle Income Countries. In this study, they did the review of various literature and gave important learnings. They explained treatment gap in alcohol disorder can be explained because of limited access to evidence based treatment, limited availability of trained healthcare professional. That means both were lacking, lack of political will and financial resources. Along with this, public's perception of alcohol is a problem, although they know it is a problem for that is for the general public. For themselves, they felt that they are using once in a while and they do not require any treatment. That means need for treatment was not considered. Further, historical stigma, discrimination with regard to persons with alcoholism also led to avoiding treatment. Poor planning and implementation of policies also play a crucial role. Invariably, the government encourages the selling of alcohol for the purpose of revenue. Hence, the government political will is very, very poor, and this leads to availability of alcohol everywhere. And the treatment for de-addiction is very less. So, since there is at the primary care level, there is no screening, none of the primary healthcare doctors are not being trained in asking about the alcohol addiction, lack of training to them or to their primary healthcare workers. At the same time, the public's perception for need for treatment is also very poor. Since there is no recognizing that alcohol is a problem at the early stage, when the patient is getting into addiction, whenever he has gastritis, whenever he has met with an accident, the primary healthcare doctor needs to talk to him, counsel him, and call for regular follow up. Since there is no prevention strategy in the earliest phase, invariably the people will land up in de-addiction only when they are severely ill because of various physical condition or met with severe accidents or when the family is broken. Then only they come for treatment. That means we do intervene only when the patient has been complicated. Now let's understand how this treatment gap is measured. The direct method is the easiest way. That is, in a prevalence study, go to door survey and check how many people have mental illness and see whether they are on treatment or not. This is the direct method. Many a time it is difficult, hence indirect method is used. That is, using the prevalence data of the nation and looking at how much psychiatric medications are sold in that country. Here, you will be using monotherapy as the guiding force, although it is a rough estimate. That means if you take the prevalence data as N1 and the total quantity of psychiatric disorder medications sold in the country as N2, here N1 minus N2 divided by N1 into 100 will give you the treatment gap. Now let's look into the factors associated with the treatment gap. There are 5 important domains you should know. One is patient-related factors, psychiatric illness-related factors, healthcare-related factors, community-related factors, and legal-related factors. What about the patient-related factors? Many of the patients are not aware they are mentally ill. They have poor insight about their illness, lack of awareness among the patient and the family member. Their explanatory model of mental illness says there is something wrong with him because of the family problems, because of the love failure, because of not getting job, because of the marriage going wrong. Hence, he has this minor mental irritation. These kinds of explanatory model, or else because of the devil, witchcraft, black magic, These kinds of explanatory model delay the treatment seeking behavior, and hence many a time they end up in front of religious people, faith healers, and various spiritual places. Many patients do fear getting admitted in a mental hospital. What will the society call them? What will the relatives tell about them? Self stigma that I'm mentally ill is another biggest hurdle. Poor family support. Family do not want to accept that he is mentally ill, and one of their own blood is suffering from mental illness is difficult to digest. What are the other factors with regard to illness? The illness, the natural course of psychiatric illness. Many a time, psychiatric illnesses start insidiously. Many a time, it becomes ill only after many months, insidious in onset, slowly progressive, episodic in nature. A person develops depression and it is there for 2 months, and later it remits on its own to recur at later date. These kinds of episodic nature, many times some patients are refractory for treatment. All these will add to the treatment gap. Comorbidity. Mental illness do not come alone. It do come with other physical illnesses, maybe diabetes, obesity, hypertension, and various other mental illnesses. Schizophrenia patient also known to have other psychiatric comorbidity. This will again further add to treatment gap. Nature of symptoms. If the patient believes the hospital people are trying to kill him, he will refuse treatment and he will refuse to come to the hospital. Further, longer duration of illness, need for treatment for many years puts the patient off and he may not come for treatment. Many a time, not available treatment, no access to treatment, and also no cure is available for various schizophrenia patients or various other psychiatric illnesses. Further, side effects of medications will add to the treatment gap. Let's look into the factors associated with healthcare. No community based treatment, only mental hospitals are there. No treatment is available at the primary healthcare center. This adds to the stigma and discrimination, cost of treatment, and many a time we talk about treatment gap of psychiatric illnesses. We are taking all the disorders, and there is a criticism. Why do we make life problems as a mental disorder? Severe mental disorder versus common mental disorder, whether to differentiate or not to differentiate. Health professionals' ignorance. Many a time the doctors may say, why are you taking psychiatric medication? That will cause addiction. That means many of the doctors are not being adequately trained in psychiatry. Myths of healthcare professionals. That is, mentally ill people are dangerous. They should not get married. They should not go for studies. Not being trained adequately with regard to psychiatry. No reliable diagnostic instruments available. All these adds for the treatment gap. Let's look into the community factors. Stigma and discrimination. Many patients do not want to go to the psychiatrist because they will be stigmatized. Lack of awareness about the mental illness in the community. Limited access to psychiatric care. The number of psychiatrists in our country is hardly 10 to 11,000 for 140 crore population. That means access to treatment is a big challenge. Insufficient resources. That means investment in mental health is very, very poor. Shortage of mental health professionals. Very recently, health insurance has been introduced for mental illness. Otherwise, health insurance companies used to refuse to provide health insurance to a person with mental illness. After Mental Health Care Act of 2017, all these insurance companies have been made to mandatorily to cover psychiatric illness. Cultural, religious, and linguistic barrier do play an important role. If you go to many temples, you can see patients coming there for the blessing from the divine God for the treatment of mental illness. Not only in temple, it may be in church and also in dargahs. And various myths in the community also play a crucial role in the treatment gap. If you look at the legal issues, for example, Mental Health Care Act, which is a rights-based mental health care legislation, which limits involuntary treatment, which advises the mental health professional to seek consent from the person with mental illness, to do capacity assessment before you take consent, making a lot of documentation, makes the available meager mental health professionals resources under strain. Since there is no community treatment order, if you violate the rights of a person with mental illness by providing treatment against his wish and will, can invite a legal provisions against the treating doctor and honoring the right to refuse for treatment. All these will come in the way of reducing the treatment gap. Now the question is, what should be done? How to reduce the treatment gap? First and the foremost, we need to come up with innovative solution. Massive public awareness program. Not only that, we need to make aware of the need for treatment and what are the benefits of treatment has to be done. Training of all healthcare professionals, including Ayush, nurse, pharmacist, with regard to diagnosis, first line of treatment, referral, and follow-up. Making access to treatment, that is, available at the community level, at the wellness center and primary health care, the treatment should be available. Using Ayush doctors in screening, diagnosing, and also doing follow-up can be considered in a social welfare society. We need to invest in mental health. We also need to think of task shifting and task sharing. Here, you enable community workers such as ASHA workers. They can be trained in screening and also referring the cases, taking medicines and giving to the family members. Those kinds of task shifting and task sharing should be done so that the treatment available is in the community. You can also think of leveraging digital technology such as telemedicine, providing drug card, and also making phone calls whether the person is on, whether taking medication or not, doing telemedicine based follow-up, sending medications directly to the doorsteps, house visits. Many a time, the government has to take proactive steps to take the mental health care to the doorsteps. Either it may be phone call, treatment reminder messages, home visits, socioeconomic support, treatment, helping the guardians, helping the family members in providing care, teaching psychiatry at the undergraduate level, to the nurses, to the doctors, to the pharmacist, integrated at psychiatric care in all general hospitals, training human resources to provide mental health care, and also the need for amendment for Mental Health Care Act. That is, we need to facilitate treatment. If there is a certain clause which comes in the way of providing involuntary treatment, should be amended so that the treatment should get the priority over the rights of persons with mental illness who are severely ill. Empowering family members to facilitate treatment. Other professionals must be sensitized, such as teachers, police, judiciary, journalists, community leaders, faith healers, and religious leaders. School mental health program should be implemented across the country. Research on innovating various treatment methods, long-acting safe injectables, safe medication, cost-effective medication should be the need of the hour. Availability of ambulance, crisis management, intervention team across all metropolitan cities, access to rehabilitation services, case managers at the community level play a crucial role. That means we need to find the treatment gap and mend that gap is a very important step we need to take to reduce this treatment gap. In this regard, World Health Organization came up with two important initiatives: Mental Health Gap Action Program. Another one is Mental Health Gap Intervention Guide, which was released in 2010. Although in some of the studies they have been found to be very helpful, but in various developing countries with multilingual, multicultural, multi-religious places, it has been not been successfully implemented. And one of the main barrier is not adapting culturally, considering the relevant local resources should be utilized in providing care. However, the World Health Report 2001, Mental Health, A New Understanding, New Hope by WHO Geneva came up with important recommendations. Although these recommendations was in 2001, till date, they appears to be very relevant. Mental health treatment should be available in the primary care. Psychotropic medication should be supplied continuously. Care should be shifted from institution to the community. Public should be educated about the mental illness, need for treatment. Families, communities, and consumers should be involved in advocacy, policymaking, and forming self-help groups. National mental health program should be implemented. Training of all healthcare professionals, linking both governmental and non-governmental organizations in providing care. Mental health system should be monitored using quality indicators. More support should be provided for research in mental health. All these play an important role. To conclude, my dear friends, treatment gap is the number of people who are mental illness who are not on treatment. To reduce this treatment gap, improving the awareness of mental illness, availability of mental health services, and also the need for treatment is an important step. Availability of treatment, easy access to treatment, and affordability of these mental health services is essential. The main reason being is mental illness is a chronic illness that requires treatment for many months to years. One need to understand what is the need. Why is the need for treatment? That is wellness and also improving the quality of life. Social stigma and discrimination is a big barrier. We need to address this in a war-footing manner. We need to have a culturally adapted interventions, terminologies. Instead of telling mental illness, many a time the people will accept the word tension, black magic, evil spirit, and so forth. Those appropriate words should be utilized and over a time should be slowly replaced. Suddenly coming up with a new terminology, the community may not accept. We need to come up with culturally relevant intervention by adding scientific intervention to that, involving local people, community leaders, religious leaders, sensitizing them, making them aware about mental illness is an important step. Unless we involve with these faith healers, religious leaders, and Ayush, we will not be able to reduce this treatment gap in our country. To summarize, the treatment gap must be bridged. That means the people who are diagnosed and not on treatment, that bridge should be closed. At the same time, treatment lag also should be shortened. As I told earlier, many patients, the first time they receive treatment only after 1 to 2 decades later. That treatment lag also should be reduced. That means we have a huge responsibility of bridging the gap and shortening the lag for treatment. To know more about my video channel, please do scan this QR code and subscribe. Thank you very much for your valuable time. Stay safe.